Hello. In this video, we're going to look at blood pressure control mechanism, the no hormone pathway. In our previous video, we looked at the 5 main variables affecting blood pressure and blood flow. In today's video, we're going to look at two different feedback loops. In one scenario, we are increasing the blood pressure, which is below baseline, and then in the second scenario, we are decreasing the blood pressure, which is above the baseline. The first one is when the person has low blood pressure. So when the person has low blood pressure, the first thing that happens is there's a decrease in baroreceptor firing in the carotid sinus and aortic arc. Decrease in baroreceptor firing in carotid sinus and aortic arc causes decrease in rate of firing in the afferent nerves. This decrease in rate of firing in the afferent nerves causes the cardiovascular center to be triggered. Once the cardiovascular center gets fired, it causes an increase in sympathetic cardiac nerve activity, increases sympathetic vasoconstrictor nerve activity, and decrease in parasympathetic nerve activity. Now, the increase in sympathetic vasoconstrictor nerve activity directly causes an increase in blood pressure. And of course, we want to decrease the parasympathetic effect because parasympathetic effect is known to decrease blood pressure, not to increase. Now, increase in sympathetic cardiac nerve activity, which is stimulation of the nerves of the heart, causes an increase in heart rate and increase in stroke volume. So it causes the heart to pump faster and it causes the heart to pump harder, causing more stroke volume to be released. And of course, sympathetic vasoconstrictive activity causes vasoconstriction of the arteries, increasing blood pressure. Now, increase in heart rate and stroke volume causes increase in cardiac output and total peripheral resistance, thus increasing blood pressure. In the second scenario, the person is presented with increased blood pressure above baseline. So what is the feedback for this? So the first thing that happens is when the person has increased blood pressure, it causes increase in baroreceptor firing rate in the aortic arc and the carotid sinus. Now, increase in baroreceptor firing in carotid sinus and aortic arc causes increased rate of firing in the afferent nerves. Increased rate of firing in the afferent nerve causes the cardiovascular system to be triggered. Now, firing of the cardiovascular center causes decrease in sympathetic cardiac nerve activity, decrease in sympathetic vasoconstrictor nerve activity, increase in parasympathetic nerve activity. This makes sense because when the person has high blood pressure, you want to decrease sympathetic nerve activity because sympathetic nerve activity is known to increase blood pressure and causes the heart to pump harder. But in this case, since the person is presented with increased blood pressure, we want to activate the parasympathetic nerve activity, which decreases blood pressure. And decreased sympathetic vasoconstrictor nerve activity directly decreases blood pressure. Now, decrease in sympathetic nerve activity and increase in parasympathetic nerve activity causes the heart rate and stroke volume both to decrease. Now, decrease in heart rate and stroke volume causes the cardiac output to decrease, and total peripheral resistance to also decrease, and decrease in cardiac output causes a decrease in blood pressure.